The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.
That's been increasing easily 100%, probably close to the 150%. That chronic illness has been increasing. Do you see the problem? Do you see the irony here? This is a little bit of insanity.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Good morning. It is time to wake up. This is the Unplugged Healthcast, and we are here to unplug you from the matrix of today's healthcare system so you can see clearly. It's time to wake up. We've been in a long stupor in America for a long time. Let's be honest, our healthcare system's been failing us for a while. And my name is Dr. Kevin Wall, and I am excited today for you to join us in the inaugural. This is the kickoff. This is the beginning, surely far from the end, of the Unplugged Healthcast. And just so you know, I'm not a rookie. You may be able to notice from the lack of hair and a little bit of a couple wrinkles, not many, but a few, that I have maybe been doing this for a while. In fact, this has been not the first time I've done a podcast. It's probably the first time I've called it a podcast. In fact, I have been involved in over 2.5 million patient encounters. Either I have directly been in them or I have overseen them as I have run a multitude of healthcare practices. And I am here to bring you some clarity, reduce some confusion, and unplug you from the system. It's time to stop taking the blue pill. Let's wake up. Come on, guys. See, I've been in the trenches for over 35 years. I have been watching, seeing the progression, the concerns, the hopelessness that is going on out there in America. We unfortunately have taken our health and our health care into the basement. We are ranking in the third world nations on our ability to keep people healthy. In fact, statistics will show you, if you don't already know, that in the last 25 years in America, we have increased our chronic illness anywhere between 40% to 150%. And if you don't maybe know chronic illness, let me just categorize for you. We're talking things like heart disease, arthritis, cancer, could be as simple as indigestion, could be even mental health in that aspects, could be diabetes or obesity. The list goes on, and there's a really good chance you're on that list. This should concern you because it has been very concerning to me. In fact, this is the main reason, if not multiple other reasons, that we should have these conversations and start unplugging you from this confusion. If we look at the increase of diagnostics available to you, the increase of treatment options out there, the ways that we can manage patients, manage their health, manage their treatment, manage their systems, man, that system, that program has been going through the roof. Would you agree? So that's been increasing easily 100%, probably close to the 150%. That chronic illness has been increasing. Do you see the problem? Do you see the irony here? This is a little bit of insanity. maybe it's a little bit more than a little bit of insanity. This has got to stop. See, it would only seem to make sense as we got better with our medical technology and understanding and diagnostics, treatment options, then we should be reducing chronic illness, right? But it's not true. It should be concerning to you. We are chasing the wrong rabbit down the wrong hole. We have been spending millions, it's billions now, on research for better medical technology. In fact, most of it, unfortunately, is focused around big pharma. That's where all the money's going, and that's where all the treatment is coming out of. We just keep pumping drugs for diseases that never used to exist just because we can. They have. The power's there. People have actually even said to you, man, you better be careful when you get on this podcast and start throwing some rocks at some of this scenario. But unfortunately, someone's got to stand up and say the king's not wearing any clothes. Okay? You are not in good hands with all of your insurance scenarios, and you definitely are not in good hands with big pharma. Okay, moving on. Understanding that healthcare is in the decline and your health is right there with it, and big pharma possibly is just sucking the life out of you and the finances out of the system to create drugs and medications that probably aren't helping us. How are we going to get out of this, right? You should be asking, where do I go? Because the hopelessness comes because there doesn't seem to be any logical answers. That's why we're here. That's why you need to plug in to the unplugged healthcare system and unplug from the typical thought process that you have been brainwashed in. So either way, here's the thoughts that's going to permeate our conversations. And when we have callers, because this show is about real people calling in with real problems, and we're going to get real and find real logical solutions, if not at least teach them and teach you how to work your way back towards hope and health again. A little more information about the podcast and upcoming, what's happening, what the Healthcast is about. We're going to have really high-level providers, guests, professionals. I've got PhDs and psychologists, psychiatrists. I've got counselors. They all half of them work for me. Some of them I just know, and some are coming from all kinds of out of the woodwork because they want to get on this show and they want to talk to you about unplugging. We've got medical doctors, we have chiropractors, we have physical therapists, we have all type of health providers. Naturopaths, we are going to have these on the show with us. We're going to be talking to you, we're going to be talking to patients, and we're going to be talking about logical, functional, obvious ways, teaching you how to think, how to be healthy, and how to get out of this mess that we have been sucked into. Let's just go with that one, all right? But before we get that, let me go over. There's 4 things that most of these shows are going to remind you to think about. 4 things that a lot of these conversations are going to be around or discussed, or we're going to bring these concepts in. And so before we do that on this first Healthcast, and hopefully you listen to this one before you listen to the other ones, so it makes more sense. But the 4 things start off with this. Health is not that complicated. Let's just give you an illustration. If you were, let's say, a farmer or maybe a gardener, maybe you worked in a plant nursery, or maybe you had a high-level botany degree, and you were trying to grow healthy plants. See, every botanist and nursery care owner, worker, teammate, as well as every farmer knows that the most logical way to grow a lot of really healthy plants is the correct amount of food, the correct amount of water, and the correct amount of sunlight. See, that's it. It isn't that much more complicated with you sometimes. If we can get you to understand what this looks like and what this means, that's why you're going to need to keep plugging into the Unplugged Healthcast so we can teach you how to understand and think and apply these principles to your life. The second thing I need you to understand, if you were that botanist and you were that farmer, or you were deciding to grow healthy ferns in your home, and you one day just decided that, hey, forget the food, water, and sunlight. That is antiquated. We need some oxycodone. We need some Prilosec. Maybe a daily aspirin, an ibuprofen. You know what? A couple of Diet Cokes. Let's throw those, and let's add some Taco Bell, and let's just every day, we're going to feed those plants any and or all of that stuff. Now, I want to ask you, because you should already be knowing, because I've asked this question to hundreds of medical health care providers, and the answer comes to them as quickly as it came to you. Do you know what will happen to your plants? See, they're going to die, and it won't take long. See, this is illogic that we would consider thinking this thrown into the human biochemistry, digestive system, into your stomach would somehow create a healthy fern. Point number 3, you always have to know and never forget, is that when you go to see Dr. Smith, when you're in to see your physical therapist, even your oncologist, or your endocrinologist, maybe even your chiropractor or your massage therapist. Let's even go down into the naturopath. And whenever you're in the room, as you meet those providers, you have to know there's only one healer in that room. And it's not the guy with the big diploma, the gal holding the clipboard. See, the healer in that room is you. See, health is an inside thing, not an outside thing. It always has been. It always will be. You have the ability to heal. You have the ability to repair. You have the ability to regenerate yourself, your tissues, your body parts. In fact, the science is clear. This isn't theory. Your body's in a cell phase of regeneration every 7 years. Your body should repair, regenerate itself. In fact, if its system was functioning correctly, you would actually stay pretty healthy for a long period of time. None of us are getting out of here alive. I'm not saying that, but ultimately, we could surely drive in a much nicer car. Because if I was the doctor and I pretended I could heal you, then I would be misleading you. You have the ability to heal yourself. I can only help unlock that. I can only help you find that, figure that out, remove interference from that. But at the end of the day, it's up to you. Once you can take personal responsibility, you got a chance. And the last point that you always have to remember and never forget is that pain is not your problem. No, pain is not your problem. In fact, in the words of the shark on the movie Nemo, fish are your friends. They are not your food. All right. Too many movies with my kids. Too many years, but if you haven't got the point, see, pain is your friend. In fact, to give you an illustration to help you see this clearly, if you had a car and you took it to the mechanic and all the mechanic ever had was a can of black spray paint, and all he did was spray over your red oil lights, your engine lights, your whatever lights are flashing, that was his plan. That was his strategy. See, you wouldn't take it back there very often. In fact, if you took it back there to that mechanic more than once, I'd be wondering how sane you are. See, this is a get crazy. Pain is not your problem. Pain is an indication of something underlying. It's your red oil light, and just to spray paint over it and continue to drive your car around and hope you don't drop your transmission. See, that's why you guys have got into this point. You've been thinking and chasing the wrong rabbit down the wrong hole, and Big Pharma has been helping you. We've got to stop the madness. We've got to figure out why your red oil lights are going off. And if we can get to the root and we can teach you how to take care of that. Find maybe good doctors that actually help you get your engine functioning, not just feeling better. Then we can back you up into hope and to health. And that's an exciting thing. All right, we're going to have our first caller here in just a moment, but we're going to take a brief moment and hear from one of our sponsors, and we'll be right back.
Pain holding you back? AFC Physical Medicine and Chiropractic Centers of Phoenix have real solutions to get your life back. With 9 valley-wide locations, we offer integrated care including chiropractic, medical, and nutritional support. Our approach goes beyond prescriptions, combining therapies to help you thrive. Don't let pain define your story. Take the first step towards living life to its fullest. Call us now at 480-210-6103 or visit afcchiropractic.com to schedule your appointment.
We have Nicole on the phone here from Nashville, and I will just set the precedent so everybody knows. Nicole is a real person. But that is not her real name. We are going to protect her privacy as she shares with us some of the concerns and health issues she's having, so we can maybe really get into it somehow, and maybe some of you can relate and learn as we try to see if we can figure some stuff out. So welcome, Nicole. We're glad to have you.
Hi, thank you. I'm so happy to be here.
Awesome. Well, we're going to jump right into it, and I know just very little, I think, from what has been told to me, but why don't you fill us in and our audience, kind of what is it, maybe if I had the magic wand, which I like to say, and I could fix 1 or 2 problems, what would we want to deal with?
Oh, goodness. I have to pick from my laundry list. It's like every year something new pops up for me.
Goodness.
But my top 2, I would say the last couple years have really been bothering me are my sugar levels. I cannot seem to get that to where it needs to be. And then I would say the past 6 months, my neck and shoulders have really been bothering me to the point where it's so stiff, like I can't turn or move my head the way it needs to, despite my various efforts of resolving it. It doesn't seem to be working for me.
Well, goodness. Gosh, I'm so sorry. And that is frustrating because it is something I have been listening to for way too many years. Unfortunately, you're another casualty in the big pharma world and the typical system that seems to let people get down to this point. But let's see if we can't back you up any. All right. So first time you've ever noticed anything, let's go with the blood sugar issues. When did you ever notice or have any tests say that was wrong?
That was about 2 years ago.
Okay. First time you've ever had, even if it wasn't this bad, any of the neck or upper back or shoulder stuff?
About 6 months ago.
Never prior to that, huh?
I mean, on and off, but nothing as crazy as the last 6 months.
Okay, well, this is a great example, and I'm going to speak a little bit to the audience here as well as this is a classic scenario where people have a tendency to kind of minimize and think like if the oil light is just slightly on, just dim, then maybe that's not a problem, and they have to wait until it gets really bright before they decide it's a problem. So, do you see what I'm saying there, Nicole? That we usually problems start slow, and as one of the concepts we tell people, pain is not your problem. It's the last thing to show up. Usually it's the last thing to show, and the first thing to go is a statement we use often. It doesn't really tell you much besides that your engine's in really bad shape. Chances are your body's been fighting it on its own internally until it just couldn't, and then it starts to talk to you. Sometimes it talks to you in blood work, and sometimes it talks to you in pain levels. So let's walk back a little bit, because I'm betting there's a time and period that something possibly happened. Let's go back. Was there an injury, a trauma, maybe 10, 15 years ago, anywhere in that time period? Car accident, slip and fall, hurt your neck, hurt your back, anything?
No.
Okay. Have you had any children?
I do. I have 4.
And when was the first and when was the last?
The first one was 2006 and the last one was 2020.
Okay. Well, all joking aside, those are a little bit like a car accident sometimes, aren't they?
Yes, that is accurate.
Not that they are personally, but the way it's hard on a mom, right? Man, this is one of the number one things most women who have come, and I've seen in over 2.5 million visits that I've watched, probably the most commonality that starts a woman's health wrong is the physical nature of child rearing or childbirth. So often just from holding the baby and bending over the child and carrying the baby, and then just the stress that follows all that. Does that make sense, Nicole? Maybe that could have been some of the origin of a few of these pains and aches?
Yeah, that definitely makes sense. He's 4. He just turned 4, and he's still getting held and laying on top of me in bed. So
yeah. And so like he is, you probably have been very strong. And I always say it's not the bowl of ice cream that causes a toothache. It's the bowls. It's not sometimes one child or rearing of one. It's sometimes it takes 2 or 3 or 4 before your body hits its max, right? And then physically it's kind of beaten up and broken down. Now you're having a multitude of things, and these are the most obvious. Is that something that you would say is true? Or if not, please correct me.
No, that makes sense to me.
All right. Well, in the hopes to really back you up, what I first I'm going to recommend is that you maybe go back to one of the first symptoms you had and figure out maybe a logical solution. If that was some trauma or pain or headache or neck stuff there, that probably is the origin of even what you're talking, the blood sugar. Because your body is one thing. It isn't like your blood sugar is not somehow disconnected from your neck pain. It's just not possible. In fact, the nerves in your neck control a lot of things, and the nerves in your middle back control organs that actually control your blood sugar. So if you're having back pain and neck pain and we're thinking somehow this is disconnected to your blood sugar, then we probably aren't really thinking very thoroughly to the anatomy of the human body. So that's our first thought. Your back and neck and your sugars could be relative. The person who's checked your blood sugar, I bet, has not maybe pointed those two together. They just have said, and have they talked about putting you on medications yet?
No, no medications, and yeah, they did not connect the two at all.
Yeah. Well, let me just take a guess. I'm curious if you've got digestive problems also with this. Indigestion, some heartburn, some bloating, things like that.
So I did really, really bad after I had my last baby, my son, and I ended up getting my gallbladder taken out.
Okay. All right. Now we got it. Well, here we go. This, unfortunately, is a very long conversation that I'm going to maybe have to, at some point, have you tune into a different show to get the full gamut of this one. But let's just briefly hit it hard and quick. Soon as somebody has got their gallbladder removed, which seems convenient at the moment because of the pain you're dealing with, I totally get it. But the problem is in your gallbladder is a thing called bile. Have you ever heard of that, Nicole?
Yes. Mm-hmm.
And that enzyme, if you have been told, is the one major thing that allows your body to break fat down. There's good fat and bad fat. We don't go down. I'm not going to go down that road, but fat isn't all bad, and there's a lot of really good fat. And fat is a female. Fat is really important for your brain, your endocrine system, which means your hormones, your ovaries, most of your cycle, which I'll bet is also jacked up here in the last 4 years. You don't have to maybe go down that road, because as your body stops its ability to digest fats as well or at all, you now start the process where your body needs fat, and it will literally start taking it out of your body from the inside. This should sound horrible to you, because it kind of is. But now that leads to a variation of other issues, from nerve problems to head and neck problems to hormonal problems, and it surely can cause organ issues. So, all right. Well, at this point, we have uncovered and talked about a variation of things. This issue needs maybe a little further look at. So what I'm going to do, if that's okay, Nicole, is going to give you just a couple simple recommendations, and then maybe have one of our team providers somehow follow up with you to see if we can maybe even shine a little more light, because this one has, like I say, it isn't just we can give you one thing and you're going to pull out of this real quickly, but I do need you to know you can heal, and it's inside of you, right? That's one of our basic principles, that the doctor can't fix you. You can, though. We got to get working with the system, and one of the major systems that we got to get working is your digestive system, because that's where all the food comes that your body needs to repair and regenerate and keep yourself healthy. Does that make any sense?
It does, yes.
And it seems like obviously this last one, where the 4-year-old, the last straw on the camel's back, got you. We're not going to call him a camel. I'm sure he's beautiful, and what a blessing. And kids are awesome, but they can be hard, as you know, and we all know. So here's the couple things I need you to walk away with. Okay. Is that first? I didn't really ask. Are you still having the digestive discomfort, or now you just have no gallbladder pain, but do you still notice you're having trouble digesting things?
So I did notice some change. The heartburn and the intense indigestion has gone away, but I have noticed other things. So.
Yeah. Well, you still have the engine's still in trouble. You just turned off the oil light. Does that make sense? By taking the gallbladder out, which was the bad organ, but ultimately your body needed that organ. It's kind of like the carburetor was just removed from your engine, and we're hoping that you're going to drive well. Now, we got to figure out how to replace some of those things. The first things you can do, of course, is really understand that when you eat fats, you are in trouble, right? You know that? Have you figured that out?
A little bit.
That your body won't be able to deal with them. Right now it won't.
Right.
Then the second thing you got to do is figure out, because there are enzymes you can purchase online, Amazon, don't buy them at Walmart, that can help you break down the fats. Okay. As you can start breaking down the fats and your digestive system starts to work better, there's a chance that something else could get better. Any idea what I'm thinking could get better when your body starts digesting better? Your blood sugars.
My blood sugar, yeah.
Yes. See, that is nothing more than an issue where your pancreas, something's wrong with the insulin, something's wrong in the system of digestion, throwing this whole blood sugar thing off, right? Makes sense?
Right.
I'm not pretending to be an expert in everything, but I am pretty good at helping you understand there's logic in how your body works. Well, right now, if that's okay, we're going to follow up with you and just see with one of our teammates to see if we can help in further. But I appreciate your time today. Hope that we shed some light for you and for people listening. All right, we're gonna let you go now. You are more than welcome. Take care. Have a blessed day. All right. Well, if you're listening, you hopefully learned a few things there, because that was a real great example of not just something that complex, but unfortunately that common today. But right now, we're going to take another short break and hear from maybe one of our sponsors as we get our next caller on the line.
After an injury, it can feel like life's on hold, but at AFC, we're here to help you get back to what matters. With personalized injury plans and our expert staff, we don't just treat the pain, we guide you back to strength and confidence. Because getting back isn't just about healing, it's about thriving. Call us or visit our website to start your journey today.
Carol, are you there?
I am here.
Awesome. Well, thank you for joining us on today's Healthcast, and we're excited to help you and see if we can figure anything out. Let's just jump into it. Is there any one specific thing that we could maybe help you unsolve?
About 20 years ago, I had bilateral knee replacements. I did bilateral because I only wanted to do it once. However, the right knee did not turn out good. And so a year after my bilaterals, I had to have the right one done again. Since then, I've still got excruciating pain on my right knee all the time. When I go to walk or step, it feels like crushed glass is in my knee, so every step I take is excruciating. And nobody can seem to figure out what the problem is.
Wow. Goodness, Carol, I'm so sorry. That crushed glass, that I in my head, I can picture that. I've had the Lego experience, where I stepped on that one, but crushed glass, no, but I can imagine, and I'm so sorry you're dealing with that. All right, well, let's dig in. We're going to ask a lot of questions maybe, or just questions quickly. We don't have a lot of time maybe on the show to dig in. If we don't get to the bottom of it, we'll follow up with you afterwards. But it's the right leg and 2 knees. And let me just ask you, do they have any plan of doing a third replacement? I'm consuming they're talking about it.
No.
No.
It's never been mentioned, no.
Okay, is that something you're thinking about?
Well, I got to tell you honestly that the second one didn't make a difference. So I really don't know,
Yeah.
Why I'd want to go for a third unless it's somebody that can absolutely guarantee me that the outcome is going to be what I want.
Yep. I totally get that, and I surely can't argue that logic. So let's stick with your logic and keep moving forward. All right, let's jump to a thought that's already in my head, which is often we are persuaded, as I talk about, chasing the wrong rabbit down the wrong hole, which means that people often have pains in their body, like hand pain, elbow pain, wrist pain, foot pain, knee pains. And we go to a doctor and they, just do an x-ray and they see something. They automatically go with what they see and assume that has to be the problem. But sometimes everybody, not sometimes, always, everybody has the right to have more than one problem going on at the same time. Does that make sense? That's fair and possible, Carol?
Yes, for sure.
And the problem is we have these doctors all segmented into their separate professions, and they have forgot sometimes that other things are connected. So I'm not throwing rocks because these guys are doing their best. Phenomenal people out there, phenomenal health providers, but sometimes they're stuck in systems that are just broken and they can't do much more than they can do. So let's see if we can help. If I go to the two things, we of course obviously must have saw in your x-ray some breaking down of the tissue, degeneration. They probably used the term bone on bone, right?
Yes, osteoarthritis.
Did they say bone on bone? Because I've heard that one a lot.
Yes, I had several orthoscopic, clean the bone out before they did the knee replacements.
And did that ever help, just curiously?
Yep.
Okay, so seemingly the cleaning process kind of bought you time?
Mm-hmm, yep.
But then it came back.
Well, the pain isn't the same now as it was before.
Okay. All right. Well, then let's maybe consider the possibility that they fixed what they saw. That's very possible, and they didn't do a bad job. And the reality is there's two problems going on. So let's go to the second most common obvious issue. I'll give you an example before I point it out for you in the crowd here that if you ever seen a person who's had a leg amputation,
yes,
they often will say their foot is killing them. Have you ever heard that? And then you have to look down and notice they don't have a foot. How could they have foot pain without a foot, right? That's a thought we should all be remembering, because this is a great example of the point that the pain is not always where the problem is at. Sometimes we have referral symptoms where your brain is registering a feeling that it actually isn't coming from there. It comes from often a place higher, like where the amputation is actually at. And that's the nerve has been severed. And so the brain is signaling the foot somehow is a problem, but there is no foot. It's because the nerve at the location of the severing is firing incorrectly. Does that make sense at all, Carol?
Yes, completely.
So now I go back to where your foot has been severed, or leg, and I'll go, man, what's your back like, Carol?
Bad.
Okay. Well, right now we probably have already found the root of the problem, because in the lower spine, the L3 nerve root, not the sciatic as much, but the sciatic could be another one, have direct nerve routes that go right to your knee. And when you impinge nerves in your back, it's often referring pain into your leg, like sciatica is a pain all the way down the leg. But sometimes you can get such specific impingements that it'll cause just specific pains like knee pain or foot pain, or in other people listening, elbow pain or hand pain or shoulder pain. So don't get misled. Just because the pain was in your knee, the problem very much probably is in your back. Does that make sense?
Yes.
All right. Well, now, unfortunately, we probably are at the end of my ability to help you, because I can't reach through the phone and fix that. But I will give you some last advice as we finish the call, which is the chances are you have one of three problems going on in your spine and your back. And one is going to be as simple as musculoskeletal, spine out of position, muscle spasms. And in that case, you need to see a phenomenal physical therapist. There are differences in those. And or a phenomenal physical medicine or chiropractic type center where they can get to the root and actually get that spine fixed. Now, the second problem could be that you could have that and or this, which is a disc problem where the disc is protruding or bulging, and that could cause issues in your nerve. That could cause knee-like pain. And if that's the case, again, sometimes physical therapy, physical medicine, chiropractic, those guys can help that if it's not too bad. Sometimes they need to co-manage that, which they can do with some type of, again, orthopedic guy who's really aware of these things and willing to help. And then sometimes if the thing has gotten really severe and the disc has deteriorated, you could have some variation of a stenosis. Still doesn't mean you're out of the loop and can't be helped, but you got to get somebody good enough to figure out how to help one of those three figure it out, and don't just start guessing, because there's ways to determine which one, or you could have a variation of all three. Does that make sense, Carol?
Absolutely.
All right. Well, I'm going to take you off the call here at the moment, but I will have one of our teammates follow up with you to see if we can help guide you towards someone that could help you. Thank you so much for participating today on today's Unplugged Healthcast. All right, guys. Well, again, you may have found there's some really interesting information on that one, where someone thinks their knee's the problem, but it may not be the knee. See, pain is not your problem. It is the indicator to help you start looking for the solutions. And sometimes they're not as obvious as right exactly where it hurts. Can we welcome in, real quick, who I'm so sorry, who am I speaking with? Ruth. I think Ruth from Rexburg, right?
That's correct.
Awesome. Well, thank you so much, Ruth from Rexburg. We've already told the audiences that this is not your real name, so you can share, and hopefully no one knows you to protect your privacy. Can you tell us if there was one main health condition we could help you with? Fill us in.
Low blood sugar.
Okay, so low blood sugar.
I'm getting it lower.
Okay, so it continues to decline. Is that what you're saying?
No, it continues to go up and insulin resistant.
Okay, so we have not low blood sugar, we have high blood sugar, or it's just going up and down all the time?
Pretty much, yeah.
All right, have they tried to diagnose you with diabetes yet?
They have, but I've been diagnosed with PCOS.
Okay.
Which kind of goes with it.
For the sake of the audience, explain briefly for them that so they know kind of what you said there.
It's polycystic ovarian syndrome, and it affects getting pregnant and having babies.
Right.
But it can also lead to having insulin resistance and other health issues.
Yes. Now, this for sure is true, but I will just guard you as I'm going to the audience. Sometimes we're told things in the wrong order, meaning that your ovarian problem causing your blood sugar issue versus whatever's causing your blood sugar issue could be causing your ovarian problem. It's possible. Let's dig into it a little bit. Are you okay with that, Ruth?
Yeah, sounds good.
All right. Well, my first question is then, being the fact you have blood sugar issues like this, I'm just betting you probably had some digestive issues over the years.
Yes.
And when's the first time you ever noticed anything like heartburn, acid reflux, taking a Tums, whatever, anything, maybe bloating, gut issues, trouble even eating different foods? When was the first time? How many years ago?
Oh, gosh, probably about 15 years ago.
15 years ago. And when were you diagnosed with the PCOS?
About 6 years ago.
And then when with the blood sugar issues?
That one was about 3 or 4 years ago.
All right. Perfect. Not perfect for you, but it's a perfect illustration of what we need you to remember and everyone listening to understand. See, these are not connected. These are completely connected. Indigestion, or the inability to digest your food, leads to your body's not able to bring in the normal things it needs to stay healthy. Does that make sense to you, Ruth?
Yes, it does.
So the origin, I can almost guarantee you, and again, this is not diagnosing and, you to go and start doing treatment, but I'm telling you, if you're thinking logically, you'd have to go to this thought. If I had enough indigestion for enough years that my system, my ovaries, my endocrine system, my inability to break down fats, which we just talked to the previous caller who had gallbladder issues. When you can't break down fats, your ovaries can't stay healthy. Your endocrine system is off because your body needs fats to make hormones. And if you can't digest fat, which is one of the harder things to break down, picture it in water, right? Picture putting fat in water. Does it break down, Ruth?
Nope, it doesn't.
No, it just sits there. It could be weeks or months or years. So you got to break that down, and your body has to have processes in place to do that. And that is called the digestive process. And if you are having indigestion, you have not been digesting for many, many years, throwing your whole system probably into this cycle. And now, of course, you have blood sugar issues, and more than likely your ovaries, of course, are not healthy. So how do we get out of this? Well, this one we're going to wrap up quickly because I wish I could say I can wave a magic wand and back you up 15 years. But to do that correctly, here's what you need to know. Your body can repair itself. And I don't know the limits, but no doctor does. You and your body knows the limit. It could repair your ovaries. It's possible. It could reverse some of those blood sugar issues and get your pancreas and insulin levels going again. But the answer is going to be, if there is one, and I'm not telling you to go follow my recommendations. You can take your own logic and intelligence and figure this out after the call. But if you could figure out how to help your digestive system digest, and you would start eating better foods, and you would do like the farmer does, as I talked about at the beginning of the show, use the correct amount of food, the correct amount of sunlight, and the correct amount of water. And if you could digest those things correctly, and you did this for over time, can you imagine what happens to the farmer's crops if he did that over time? Any idea, Ruth?
Oh, yeah, he gets to have a harvest.
He does. And those plants, even if you look at vineyards, it takes years sometimes for those to really produce healthy fruit. So you got to start today, and you got to start helping yourself. You are the doctor. Number 3 rule in my system is that if you know you're the doctor and you start treating yourself, you start with digestive enzymes. You start with probiotics. You start with anything and everything, and going to a doctor, or probably a naturopath, that's going to help you digest your food correctly. And now when your body is doing that and you're feeding it correctly, and you give yourself time, and you follow maybe somebody who actually understands this system and doesn't think your ovaries maybe are the only thing wrong independently of everything else. They're all connected. They're all related. And this is not a belief system. This is straight anatomy. When we know that and we start working from the beginning, which sounds like it was 16 years ago, we got a chance. Don't we, Ruth?
Yep, we do.
All right. Well, don't give up. Start at the beginning and stick with it. Thanks for calling today. All right, guys. Well, today, I hope you have learned something. This is something I've been hearing for many, many years, way too many years. But you now are in with me, and I bet you are learning. There are some ways, some thoughts, some concepts you got to consider changing. All right. Well, we got to stop today and let you go. But I need you to know, if you need further information, you want further help, if you listen to this podcast and you want some answers yourself, there's a couple things you can do. You can go to drkevinwall.com, find our website. You can become a caller if you would like for future shows, or you can look for information or help or appointments to some of our recommended providers. That will be available there. But minimally, we need you to subscribe to our podcast, right? Our Healthcast. I ask you to share, and if you don't mind, go on the Spotify, the YouTube, wherever you're listening on this, and give us a 5-star review, because it helps the algorithms so people find us, people hear us, and people learn how to become healthy and they get hope again. But until next show, this is Dr. Wall, and I'll see you again on the Unplugged Healthcast. Can't wait to see you there.